doctors, medical doctors, come consult with us, advise with us for free on live radio, Mondays through Fridays, 10 a.m. Today we have Dr. Ewonawo, but first I should say congratulations are in order, because the last time we spoke to Dr. Ewonawo, he was the senior registrar, he was first vice chairman, but today, Dr. Ewonawo, we cannot see you, but today Dr. Ewonawo is consultant obstetrician and gynecologist chairman, Nigeria Medical Association, Lagos State. Congratulations, sir.
Thank you very much.
Big congratulations. I would like to ask that, what can somebody do to reach chairman position?
Yeah, you work very hard, and good morning, my dear sister. You work very hard. You follow the constitution. It's a democratic process, so just follow the democratic process. Once you follow the process, you are good to go.
But I suspect that is a lot of work. Like, it's not just about the title. There's a lot of work there.
Yeah, I agree too.
Wow. So you're basically in charge of everything that has to do with the medical field. All doctors, they're under you right now in Lagos State, right?
Yeah, and the servant to all doctors.
Congratulations, sir. That's a big deal. We celebrate with you, and we hope that God will give you grace to be able to, do all that you need to do in that position. Okay, this morning we're going to be talking about early pregnancy, what's normal and what is not. So this morning we're going to be talking to Dr. I want to work on that. But before then, we are live on YouTube at WFM917.com, at WFM917, or you can listen to us live via our website, www.wfm917.com. The phone lines will be open shortly, but you can send your text, WhatsApp messages, or voice notes to 0703 1756537 or 08155 917 917. Okay, let us get into it. Dr. Ewonawo, for many women, the first few weeks of pregnancy can be very confusing, can be overwhelming. Things are happening in your body that you've never experienced before. So what are the early signs or the earliest signs of pregnancy that people should pay attention to? I mean, people, of course, the woman, first of all, because it's happening in her body, but then husband, family members, and all of that.
All right, thank you very much, my dear sister. And once again, I'm glad to be back on air after a while.
Glad to have you. Hi, Dr. Ewonawo. We can no longer. Okay. Yes. Yes, I can hear you now. Yes.
All right. So thank you. You're talking about the very.
Hi, Dr. Ewonawo. The network has bounced him out. This is still Women Radio 91.7 FM, the voice of women, Nigeria's first and only radio station for women and their families. And you're listening to me, Fumi, on RadioDoctor this morning. I think that Dr. Ewonawo is back. Yes, he's back.
Yeah, I have to be getting a lot of calls here and there.
Yes, yes, now, as the chairman, yes, now. It's okay. Go ahead, sir.
Yeah, thank you so much. Yeah, we're looking at, the confusing parts of the early parts of the pregnancy, right?
Yes.
All right, thank you so much. All right. So the early signs of pregnancy commonly, there are certain signs, symptoms you see in the early part of the pregnancy. It could be that a woman actually missed her period. This could be one of the things that could this a woman that has regularly been seeing her period, suddenly she's not seeing her period again. Now, these are some of those symptoms, or signs of this, pregnancy. And others could be that she now start feeling nauseous or even outrightly vomiting. Some might complain about pain in their breasts. Some of them, they feel easily full. They don't feel like eating. Some talks about them urinating frequently. Others feel so tired, and others might just say their food just by the smell alone. They say they are no longer eating this food again. These
Mm-hmm.
are some women may even experience some forms of what we call cramping, mild, very mild, not so disturbing, not so worrisome, very mild pain in the lower parts
Mm-hmm.
of the abdomen. They actually complain about some of those things, and
Mm-hmm.
really these are some of the symptoms, signs or complaints that they have at the early parts of the pregnancy.
Right. Thank you so much for that. So a lot of women begin to panic the moment they notice symptoms. So, what symptoms are normal in early pregnancy and what symptoms are not normal? When should they begin to worry, or when should they begin to move to the hospital when they see certain symptoms?
Well, the first thing is that many of these symptoms actually, occurs when a woman is pregnant.
Mm-hmm.
Usually, these are some of the symptoms that they experience or they talk about in the first early part of the pregnancy. It might just be
Mm-hmm.
that they are having this mild cramping in the lower part of their abdomen.
Mm-hmm.
They might complain of feeling nauseous. Some of them might even be vomiting, like I said earlier. Some might just
Mm-hmm.
be that they have this pain in their breast. Some might be so weak. Surprisingly, some of them might have mood swing. You see a
Mm.
woman that looks jovial, the next time she's already looking withdrawn. So there could be this mood swings. Some of them could complain about having some forms of, vaginal discharge,
Mm-hmm.
others talk about, dizziness, but the dizziness is really nothing to worry about. So it's not as maybe they are fainting or something. They might just feel like, oh, I'm having dizziness and all of those things. And these
Yeah.
symptoms are actually commonly caused as a result of the hormonal changes. When pregnancy occurs, we have hormones of pregnancy. These hormones are meant to actually keep the pregnancy going. So as a result of these hormones, that are now coming to play, they have all of those changes. And one of the reasons also why they have some of these symptoms is basically because there's increased blood flow now, increased blood flow to their body. And in most cases, of course, these are not something to be worried about. All of these symptoms we talked about, there's nothing to worry about.
And all right, okay, great. Okay, now morning sickness. A lot of women say that they feel nauseous the whole day, and it's not just in the mornings. Why does this happen?
So I didn't get that. Can you take that again?
Morning sickness. We're talking about morning sickness
Okay.
now. The question is, some women say that they feel nauseous the whole day, they're vomiting the whole day, and not just in the morning. Why does this happen? And how does this even differ to hyperemesis gravidarum? Yes. Yes.
Okay, I'll explain both now. Yes, the word more to just be it can be so misleading, and
Mhm.
it
Yeah.
can make you think as if the word morning there actually connects morning. No, 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 not really. So morning sickness is actually something that's actually very misleading because nausea in pregnancy can actually occur at any time of the day, whether morning, whether afternoon, whether night. So long as woman is pregnant, these are some of the symptoms you see in early parts of the pregnancy.
Mm-hmm.
So it can occur at any time of the day. And this is usually as a result of certain hormones. Remember, we talked about some hormones of pregnancies, and
Mm-hmm.
this hormone has a role to play, particularly in the early part of the pregnancy. And
Mm-hmm.
some of it one is the human chorionic gonadotropin, which is actually very important in the early parts of the pregnancy, what we call the HCG. And other hormones, of course, you have the estrogen also has a role to play in this early part of the pregnancy. So when
Mm-hmm.
they have high level of this hormone circulating in their system, all right, so they tend to have this nauseous of the thing, vomiting, and all of those things that can occur at any time of the day, whether morning, whether afternoon, whether night. And some of these women feel worse, with it, you know,
Mm-hmm.
they're hungry, when they are tired, they feel worse with it. And usually, you see this morning sickness of and what's the time as morning sickness really? In the later part of, be around after like late 5th weeks to like 6 weeks, but usually in the first trimester, less than 13 weeks of gestation. And that is where you see that this complaint seems to be more. And of course, as the
Mm-hmm.
pregnancy advances, it gets better. As soon as they leave the first
Right.
trimester, it gets better.
Okay, on that one, I want to ask about the spittle. Like, there's some women who spit all
Hold
through.
on. I
And
didn't, I didn't address the upper MSc diagram. Sorry, I forgot.
okay, no, you haven't. Yes.
Okay. Now, the upper MSc gravidarum, if you look at the word hyper simply means high.
Mm-hmm.
Gravidarum means pregnancy.
Okay.
Emesis means vomiting. Now, when a woman is vomiting excessively in pregnancy, that is hyperemesis gravidarum. And
Okay.
when you vomit excessively in pregnancy, the woman could be dehydrated, the woman could lose some electrolytes, and
Yeah.
of course, that tilts the woman towards some complications, and she could end up having what we call adverse pregnancy outcome. So, for such
Mm.
women with evidence of hyperemesis gravidarum, of course, they have to be admitted. That is not normal, and treatment will be started immediately for them.
Right. Okay. What about women who have spit in their mouth? Is that what was that as a result of, and they spit from the beginning of their pregnancy till the end of their pregnancy?
All right, thank you very much. Well, another thing is that pregnancy is not exactly the same for all women.
Yes.
Remember, I said that we could have these symptoms. In some of these women, these symptoms could be exaggerated. Some could be mild. Some people not even have these symptoms that we are talking about. But one thing
Mm-hmm.
you must understand is that pregnancy actually varies between two women. That is one.
Okay.
Secondly, even that same woman, the experience she had, for example, in her first pregnancy, may not necessarily be what she's going to repeat in her second pregnancy. So that means all
Hmm.
pregnancies have their own unique way. Okay, they have their own unique way. So it's not exactly the same in that woman, and it's not exactly the same between women. For some women, where these symptoms are actually exaggerated, very high, like all those, hypersalivating and all of those things. It is
Mm-hmm.
when you have this high level of circulating hormones that we talk about, like for example, the human chorionic gonadotropin, the
Mm-hmm.
HCG, then the estrogen. When you have these things in excess, you could have these symptoms also to be exaggerated. So it could actually happen because of this high level of hormones.
Interesting. This is well. Okay. For women who see, we're talking about early pregnancy and the signs, what's normal, what's not. Some women struggle to eat because certain smells, maybe certain food, even cooking would make them suddenly sick. What causes these? I know you mentioned hormones when it comes to the spit in their mouth. Is it also hormones that causes this strong food aversions or sensitivities?
Yes, yes, it's still the same,
Yeah.
the same reason. One of the things that happens is that because of this hormone, because of hormonal levels that changes in pregnancy,
Okay.
part of it that can actually happen to them when they are pregnant is that it tends to have this aversion for food. Remember that one of the things that happens to them is that they keep vomiting. So when they even keep vomiting, you have to say that they are unlikely going to even say they want to take anything because at the end of the
Yeah.
day, when they even take food, there's a likelihood for them to actually throw up. There's and remember we said that this nodules and this vomiting that occurs as a result of this high circulating level of this pregnancy of hormones. So once they have it and they know that they're likely going to be nauseous when they take this food or they're likely going to throw up, of course the best for them is to try as much as possible to have this aversion for meals. So it's as a result of
Mhm.
this hormone of pregnancy.
Hmm. Wow. Wow, wow, women are trying though. So let's move over to tiredness. I was watching a video yesterday, and the lady was saying, even when she was speaking, she was very, very out of breath, and she was like, "Oh, I'm like, this is the pregnancy is making me tired. One thing, one thing, one thing." So extreme tiredness is something that is common in early pregnancy, but on the flip side, we see society sometimes condemning women and saying that Olelun share, it's not that you're lazy, you're just
I think
exaggerating.
there's a problem with network. I can't hear you clearly.
Oh, okay, can you hear me now?
Yeah, it's better now.
Okay, it's better now. I was talking about tiredness, extreme tiredness that we see that is very common in early pregnancy. And so for me, if I see a pregnant woman, I'm like, Rara, don't move up and down. Yet we have people in the society who look at pregnant women and say that they are pretending, they are exaggerating their tiredness, they are lazy, you want to call them alone, kind of thing, right? Why, medically speaking, why is the first trimester so exhausting? That's number one. Are these women pretending that they are tired? That's number two.
All right, thank you very much. Now, the first trimester actually places a huge physical demands on the body of a pregnant
Hmm.
woman. Remember that in pregnancy, you still have these hormones, such as the one we call the progesterone, because
Mm-hmm.
the progesterone is part of the hormone of pregnancy. And what the progesterone does really is to actually keep the pregnancy growing. Because there's something you call progestin block or myometrial quietening, is to
Okay.
keep the pregnancy growing. So hormones such as progesterone, the level of this progesterone continue to increase rapidly. Okay,
Mm-hmm.
and once this level continue to increase rapidly, so as to maintain that pregnancy. Now, one of the things that can actually tilt the woman towards is to make the woman feel sleepy. The woman might become so sleepy and become so tired because
Hmm.
of some of these hormones of pregnancy known as the progesterone. So the woman becomes sleepy and she becomes very tired. All right. Now, at the
Mm-hmm.
same time, the body continues to increase in the blood production. And of
Mm-hmm.
course, at this time also, the body to form the placenta anytime from 10 weeks, 12 weeks, so that the placenta can support the growth of the baby. Of course, it's important for her to know all of these things to be formed. Now, the more important thing here is that as this continue to support the growth of the baby, the energy level in this woman now drops significantly.
Right.
Even in woman that seems to be very healthy and active before the pregnancy. So that energy level now drops in them so dramatically, and they now look so
Hmm.
weak, they look so tired. And out of misconception, you might think that these women are weak. They are actually not weak. It is the effect of these hormones of pregnancy that has actually predisposed them to all of this.
I don't even understand why people should talk to say that a pregnant woman is weak, because it's almost, let me ask. There's some people that say that, oh, pregnancy is not a sickness, you can just get up and do it. Is there, we know that pregnancy.
Those things that they do. They can make the human feel so sleepy. They can make the human feel
Mhm.
so tired. And apart from that, during pregnancy also, the human body is going to increase blood supply to other things. It's going to produce placenta, to maintain the pregnancy for that woman. As a result of this, that woman energy will drop drastically. She now
Mm.
looks so sick. She now looks so tired. You
Mm-hmm.
understand? So if you may want to argue, some people may want to argue it outside of the medical field and say that pregnancy is a sickness. It's actually not a sickness. All
Mm-hmm.
that is happening are all physiological. They are normal. So it is actually
Mm-hmm.
not a state of disease. So that's what I'll
Okay.
say to that.
Okay, thank you so much. So let's talk body changes and maybe what do you call it? Yeah, body changes, breast tenderness, body change, bloating, headache, dizziness, mood swings, like you mentioned. Why does the body change so rapidly in the first trimester? In fact, some people already can tell that a woman is pregnant just by looking at the body. I can't tell. I only know a woman is pregnant when I see a belly, to be honest. But some people can tell. Why does the body change so rapidly, especially in the first trimester?
All right. Now, pregnancy actually causes one of the most dramatic hormonal shifts, the
Hmm.
body ever experiences. Pregnancy causes because there's a rising level of some level of hormones. For example, the hormones of pregnancy that we keep talking about, i.e.,
Mm-hmm.
the estrogen and progesterone. And what they do is that they affect partially every organs of the body. And one of the things that you see is that the blood vessels will actually relax. The blood vessel has smooth muscles and smooth muscles, and when some of these hormones like the progesterone act on these smooth muscles, it will relax. All right. Even the blood pressure at a point also, will be fluctuating. It can even go down because of the effect of this progesterone on the blood
Mm-hmm.
vessels that has more. So the blood pressure tends to even come down lower than what it was before pregnancy for that woman. And of
Mm-hmm.
course, they can have problem with digestion as well. The reason why they can have problem with digestion is that all the organs that is involved in digestion also they tends to relax. They are not contracting the way they should because of this these hormones of pregnancy that we call relaxation of where there is smooth muscles generally. And of course, the breast itself now begins to prepare itself for the woman to eventually start breastfeeding when she
Mm-hmm.
eventually puts to bed. So all of these organs will actually be affected. So this rapid adjustment explains why you have so many early symptoms in the pregnant women. because the organs of the body are affected, the breast, the uterus, the, hello. So
I
they're
can
all
hear you.
affected. So that
All
explains
right.
why you have all of this happening to the woman. Yeah.
Okay. All right. This is still Women Radio 91.7 FM, and we've been speaking with Dr. Ewanowo, who is the current the current chairman of the Nigerian Medical Association of Nigeria, of Lagos State. I say of Nigeria. Who knows? But yeah, maybe I've spoken it out now. But who knows? Who knows? When it happens, Dr. Ewanowo, you have to give me prophet offering. You have to give me seed. But he's now the consultant obstetrician and gynecologist as well. So please, 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 when you see Dr. Iwano, put some respect on his name. But we've been talking about early pregnancy, what's normal and what's not. The phone lines are now open: 07000 917 917 or 0800-1235-917. Those are the numbers to call us this morning if you have a question about someone who's pregnant beside you. Maybe you're the one that is pregnant. Maybe your wife is the one that is pregnant. Maybe it's your sister. Please call us and ask Dr. Ewana, our chair, questions about, symptoms of early pregnancy, what you've noticed with your family member or a friend. You can text, WhatsApp us, or send us a voice note on 0703 1756 537 or 8155, beg your pardon, 917 917. We are live on YouTube at WFM 917, and you can listen to us on the go via our website, www.wfm917.com. Right about now, the time is 29 minutes to 11. And yeah, we're just going to go on to the next question. Dr. Ewanowo, cramps. You mentioned cramps earlier on. Cramps, spotting, light bleeding. Me, once I hear that there's abdominal pain or anything, I'm already panicking, because it could be that maybe is a threatened miscarriage or whatever. But what kind of pain is a warning sign? What type of cramping is considered normal?
Okay. The truth is that mild cramping or mild pain, okay, is actually similar to the pain you see during menstrual pain. Can
Yeah.
actually be normal in the early pregnancy, especially because the uterus is going to increase in size so as to accommodate the growing fetus. It's going to increase size. So you have this relative degree of discomfort or cramp. It is not actually out of place. However, when the pain becomes so severe or is getting worse, okay, and you have a situation where the pain is even involving the shoulder parts of your part, the shoulder, and it's not pain around the shoulder, because all of this thing means a lot. Or you have pain that is not associated with a woman becoming so dizzy, fainting, or even having heavy blood, with that pain, because it could mean a whole lot. It could be an abnormal pregnancy, okay. For example, if a woman is having this, heavy bleeding, she's feeling dizzy, probably it could be a sign of miscarriage, for example. So that pain should not be likely. Or the woman is having fainting spells, the pain is not involving the shoulder and the tip of the shoulder. It could be because the woman, for example, has a ruptured ectopic pregnancy. So this is not a pain for her to take lightly in terms of, when it's becoming that severe, the shoulder pain, she's now feeling dizzy or loss of consciousness or fainting spells. But however, if it's just a mild cramping pain that is looking like the menstrual pain, this could be normal, especially in the early pregnancy. You can even have what you call the implantation bleed. Implantation bleed can even come with some of those pain, but there's nothing to
Right.
worry about. But the moment you are seeing blood clots, it's becoming heavy, you are feeling dizzy, it's involving the shoulder, please see your doctor immediately. It could be a sign of miscarriage, or it could be a sign of an ectopic pregnancy.
Yeah. Okay. So how does it? So how a woman can know the difference between the blood she's seeing is if it is like a blood clot, or how does she know which one is? Because we are told that during early pregnancy there can be some spotting. So how does she know which one is the light one? Because sometimes this cramping does come with, blood. So how does she know that it's just not normal harmless spotting, or whether it is dangerous?
Okay, thank you very much. Now, light spotting can actually occur really in early pregnancy and does not
Okay.
always mean that a woman has a miscarriage. It could be because maybe as a result of implantation, where the fertilized ovum is getting attached to the wall of the uterus, so she could have spotting, for example. However, when you see a situation where the bleeding can be so worrisome, so disturbing, really, is when you now start having situations where you have a situation where what is coming out is so heavy. The blood you are saying is so heavy, and it's heavy there means that you now have thick blood coming out with it, and this is associated with pain, severe pain, and it contains this clotted blood. And beyond the fact that what you are saying that clotted blood and is so heavy, the person could as well complain of she's feeling dizzy, she's feeling weak, she's feeling tired, she wants to faint because what she's losing, the amount of blood she's losing is so much. So any bleeding, during pregnancy really is enough for a woman to present at the hospital so that she can actually be assessed by the doctor to see whether what she's having is actually is actually spotting, sorry, or what she's having is actually a miscarriage. Because once she's having this, heavy menstrual bleed, there's thick blood coming out with it, what's referred to as blood clots, and she's having this feeling of, oh, I'm tired, I'm weak, I feel like fainting. She must see the doctor immediately because this could be signs of a miscarriage.
Hmm. Please, if you're a lady out there, you heard what I was said. Please, the moment you are feeling uncomfortable, don't wait to check whether it is dangerous bleeding or it is big cramping. Carry yourself and off to the hospital. Please, 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 please. Doctor, there's some women who don't feel pregnant at all in the first trimester. Should they is it normal? Because typically what happens in the first trimester is you hear of women complaining that I'm so tired, oh I can't move, or back on. But there are also some women who don't feel those things. Should they be worried that they don't feel anything, or that the symptoms they are feeling are normal, so to speak, and that they don't seem the symptoms are not like pregnant symptoms? Is this normal?
Yes, they don't actually need to feel so worried. It's really not necessary, really. But then, yes, I know this. Some women were like, wow, yes, they don't really need to feel so disturbed because the truth is that some very normal pregnancies will actually produce, the woman will come down with very mild complaints. Some may not even
Mm,
have any complaint. Some may not even have any complaint. This does not mean that the pregnancy is not growing well. So they may have
mm,
complaint, they may not have any complaint at all. The point I'm trying to make here is that the fact that a woman is not feeling nauseous or she's not getting tired does not in any way mean that something is wrong with her pregnancy.
right.
She needs to get that clearly, that the fact that she's not feeling nauseous, she's not feeling tired, as expected, does not mean that something is wrong with her pregnancy.
Mm-hmm.
Pregnancy, the expense of pregnancy actually varies. I said this earlier, if you
Yeah.
remember, that the
Yeah.
expense of pregnancy actually varies between two women. And even
Mm-hmm.
in that particular woman who has had more than one pregnancy, the experience she had in her first pregnancy may not necessarily repeat itself in the next pregnancy or in the third pregnancy. So it actually varies. So once they are having mild symptoms or they are not having any symptoms, it does not in any way really mean that there's something wrong with the pregnancy.
Right. Okay. Thank you so much for that, Dr. Awolowo. Okay. What are the danger signs? Are there any other danger signs besides the cramping, besides the bleeding in pregnancy that should not be ignored and that requires urgent attention?
All right, thank you very much. One thing I want to say, women, because we keep talking to our women, because as women experts, we place so much premium and emphasis on the health of the
Mhm.
woman and that of the baby. We actually place so much emphasis and premium on it. Now, women should at all times seek for urgent care. If, for example, they are pregnant and they notice that they are bleeding, especially if you notice that even the bleeding is even so severe, so heavy, so to say, where they are now passing even thick blood, or they haven't seen blood at all and they are pregnant. or they are having abdominal pain, or even their shoulder, they notice that they are having pain around their shoulder, or they feel like fainting or collapsing, or they might even feel that their body is warm. All right.
Mm-hmm.
When you also notice also that they keep vomiting, they keep on throwing up, they are not tolerating anything through the mouth, they feel so dizzy, or they even find it very difficult to, to breathe, the way they normally breathe, they
Mm-hmm.
should report immediately to the hospital. The reason is because
Right.
pregnant woman, particularly in the early part of the pregnancy, once she's having, heavy bleeds, dizziness, and all of those things, could be a pointer to a miscarriage. Or she's having abdominal pain, not that she's bleeding, but she's having severe abdominal pain, and she's having pain that's even involving the tip of her shoulder. That could even be
Hmm.
ruptured ectopic pregnancy. So for such women,
Right.
they must present to the hospital immediately because of the morbidity and mortality, that is associated with this kind of condition. They must, these are danger signs, and they must present to the hospital immediately.
Hmm. Tip of the shoulder. Wow, that's the first time I'm even hearing of that. Okay, okay. Please, please, please. Hospital, please, please, please. There are certain foods that I remember the times I was pregnant, I was told to not eat because they could cause miscarriage. Foods like pawpaw, foods like pineapple, even drinks like Zobo drink. Is there any truth, any medical truth to these claims that there are certain foods that they are catalysts to miscarriage?
So I think that's
There are certain foods that people believe aid contraction when you're pregnant and that they cause miscarriage, especially when you've not gotten to term. Foods like pawpaw, foods like pineapple, foods like I think a little bit of orange because of the citrus acid in it, even drinks like Zobo. Those were things that I avoided when I was pregnant. But is there any medical truth to this that there are foods that speed up whether contraction or cause miscarriage?
okay. Thank you very much. Well, medical practice is about evidence, and it's about proof, it's about
Mm-hmm.
science. There must be scientific basis for what you're saying
Mm-hmm.
before you make any comments on issues that do with human death.
Mm-hmm.
So really, there's really no scientific, no, as in strong, very strong one, no scientific evidence that supports that when you eat the normal amount of pineapple or pawpaw, for example, it
Mm-hmm.
can actually expose you to a miscarriage. Because if you look at
Mm-hmm.
miscarriage generally in the first trimester, they are most of the miscarriages. You may not be able to say that this is the reason why this person have miscarriage in this early part of the pregnancy. For most of the cases, you may not be able to say. However, for those that were able to identify that, so this woman has miscarriage in the early part of the pregnancy, in about 50 to 70% of cases, it is actually due to chromosomal abnormalities. Where there is
Okay.
chromosomal abnormalities, this can, there are various types of them. This can be Down syndrome, Edward syndrome, Patel syndrome. These are all medical jargons anyway. So it can be due to this chromosomal abnormalities. So other reasons why a man can have miscarriage, for example, in the early part of the pregnancy can be due to the fact that maybe the woman has some medical conditions, for example, like uncontrolled diabetes mellitus in pregnancy, or maybe she's on certain drugs, for example, drugs that are taken for epilepsy. She's taking it in the early part of her pregnancy, or maybe because she has some problems within the womb. For example, if she has a lot of fibroids, uterine fibroids, there's no way the pregnancy may probably want to survive without pregnancy in that environment. So the presence of fibroid in the womb can also predispose the woman to having, miscarriage. But of course, the issue of pawpaw and pineapple, there's really no strong, evidence, scientific evidence to really support that. But one thing we must also know is that it's also very important for us to avoid, unsafe food. For example, food that are unpasteurized. We must try as much as possible to avoid them. We must avoid alcohol also during pregnancy. Prevention is better than cure.
Absolutely. Prevention is better than cure. There's no point. You can wait 9 months to have these things. You don't have to have them immediately. Okay. Dr. Ewan, how important is antenatal care in the first trimester? And when should a woman ideally book her first antenatal appointment?
Well, antenatal care, remember in one of our discussion here, we talked about it. antenatal care, but I'll just talk about this again very briefly. Because early antenatal care is actually very, very important, very, very important. Because you're talking about a pregnancy that you want to, end up so that the woman can go home with a good baby, and the woman herself is actually healthy at the end of the delivery
Yeah.
experience. So early antenatal care is actually very important. Ideally, women should actually book for their antenatal clinic as soon as they confirm that they are pregnant. Usually, we say that when she misses her two periods, two missed period, that's about 8 weeks. So between 8 to 10 weeks, actually, a woman can actually come, to book for antenatal clinic between 8 to 10 weeks. Because early care will actually help to pick if there are any medical conditions. You can actually pick it if you register early, and more so also you can use that to actually date the pregnancy, because currently what they do in the UK now is what we call the scan dating of pregnancy, which has been found to be. Oh, thank you very much. Yeah, the commonly we have early pregnancy tests that we do. They are called the routine antenatal tests. These are the things that we do for them as soon as you notice that a woman is pregnant and she has come for booking or registration. We do this test for them. And some of these tests will include, we do a blood group and resource for them. For example, about 94% of human being all over the world are actually resource positive, while about 6% are actually resource negative. So we have to do a blood group and resource status for them, such that
Hmm.
once, for example, the woman is resource negative and the husband is resource positive, we have to monitor the woman very closely and start giving some form of injection to her at about 28 weeks and even after delivery, so that the baby does not have what we call hemolytic disease of the newborn, or baby even die within the mother because of the ISO immunization. So for that one, we want to do blood group and resource for them. Other things we want to do for them, we want to do a PCV for them or do a full blood count for them. In that part, in the PCV, we want to look at the blood level. Because if the woman has anemia, there's tendency for the baby not to grow very well. And even if the woman decides to even during labor and she has this low level of blood, there's tendency for her to have what's called primary postpartum hemorrhage. She could bleed from that, and she could even have infection as a result of this low level of blood. So we want to look at her blood level. It's very important that we
Okay.
do that. So we want to screen this woman also for certain infection like human the HIV test. We want to screen the woman such that once we notice, for example, that the HIV test, for example, is reactive, she has to be started on certain medications known as there's a regimen that we even give to them, the lamivudine, the tenofovir, and the dolutegravir. These are all drugs that are given to HIV positive women, and they do very well. The essence of giving this drug is to reduce the risk of mother to child transmission of infection, and this can go as low as less than 2% when this drug has started, early for them. So we want to screen them for this HIV test. We want to do hepatitis B for them also. Hepatitis B is actually done for them, so that when we notice that the human is positive, we do further investigation like the hepatitis B panel. And of course, if there's need for us to start treatment for the woman during pregnancy, we'll start that also and refer her to where she's treated with the pregnancy. But as soon as the baby is born, also, the baby will now be given certain injections so that the baby does not come down with infection. Other things that we do for them will be a urine test. We want to look at it. Is that glucose in this urine? Is that protein in this urine? And start treatment immediately. And of course, we want to monitor our blood pressure very closely, because as we speak now, high blood pressure in pregnancy is the second most common cause of death among pregnant women, following blood loss following delivery. Because blood loss following delivery of death among pregnant women, then high blood pressure in pregnancy. So we want to screen and look at our blood pressure regularly. And once you notice that the blood pressure is on the high side, we want to start our medications that will help lower our blood pressure. Another thing that I want to do for this woman will include that we want to do scan for her, for example. And of course, in that scan, it's important for us to do the number of babies she's carrying, and of course,
Right.
to date the pregnancy, be sure that we are sure of the exact age of the pregnancy for that woman, so that she can be delivered at the right time. Now, if you do all of those things, they have been shown to actually, reduce certain risks that are associated with pregnancy, and of course, they will improve outcome for both the woman and the baby if this investigation are actually done and they are managed accordingly.
Okay. I find that when women have complications in their pregnancy, or maybe when they have miscarriages, they lose their baby, they blame themselves. Are is this something that women should do? Are they correct in blaming themselves, or is it something that just could not help itself from happening? Or are there situations that women could have actually helped themselves but did not, that now caused, a baby loss or a miscarriage?
All right, thank you very much. Miscarriage is the loss of pregnancy before the age of viability. And then
Mm-hmm.
when the woman loses pregnancy, really, it gives psychological concern to even the woman herself, even the healthcare provider, the doctor that's even managing that woman. But you know that pregnancy goes with a lot of emotions, you understand? Which is not unexpected anyway. It goes through more emotion. So when the woman loses pregnancy, she begins to ask herself, where did she go wrong? How did she go wrong? And all of those things. What could she have done to have
Mm-hmm.
prevented my faults? Where did I hit and all of those things? The truth of the matter is that it's not the fault of the woman. Because if you remember what we said earlier, that most of these miscarriages that occur, you really do not know the cause of this miscarriage. So you cannot, something that you do not know the cause of it, you cannot not blame somebody for it. You cannot blame the woman for it, and the woman must not even blame herself for it, because
Mm-hmm.
even the cause of it is not even known. The one we are talking about is the one that the causes are actually known. That is the one
None.
we are talking about. All this
Mm-hmm.
chromosomal problem, diabetes in pregnancy, uterus, when you have fibroid in the womb and all of those things. So it is never the fault of the woman, and she must not in any way blame herself to be responsible for the loss of that pregnancy. So at that point, really, they need a lot of support, psychological support, emotional support, partner or partnership, and all of those things, so that they will know in very clear terms that what has happened just happened, as it never any fault of theirs.
Mm. Thank you so much, Dr. Warner, for coming on the program today. In just one word or a sentence, do you have a final word for women? What would you like every woman, family members, to understand about what pregnant women truly experience during early pregnancy?
Well, early pregnancy is not, let me use this word now, it's not a child's play. Early
Mm.
pregnancy is not child's play, I'll put it that way. And it's not something that should be seen as something very minor or insignificant, even in the first and few weeks of life. Now, a woman's body will undergo a lot of changes. This can be physical, due to physical, hormonal changes, even emotional. This thing occurs during this early part of the pregnancy. And some women can actually cope easily, while others will actually, struggle to a very large extent before they can actually cope with the changes that occur in their pregnancy. So what I would say is that for every pregnant woman, honestly, they need a lot of compassion for us. We need to be very patient with them. We need to support them. And we need to show understanding to a very large extent to know what they are going through. But more importantly, women should know this, that not every symptom is danger. It should just calm down also, because not every symptom should be danger. Not every complication is actually their fault. They should have that at the back of your mind. Just say that not quite long. So pregnancy is something that every woman, once they are pregnant, they really deserve to have proper care. They need to be supported emotionally, and for every complaint they are giving, should be taken seriously and followed up by the spouse, the partners, and the healthcare providers.
Thank you so much, Dr. Ewanoma, for coming on the show today. Today was very, very informative, exhaustive. I'm sure that some people will listen, I'm sure, but people typically don't want to call because pregnancy can be very, very hush hush. Nobody wants to expose themselves and things, and that's fine. But please make sure that everything that was discussed today, you take it to heart. You're not careless, in your pregnancy, and those around you also pay attention to all the symptoms, all the signs that you're also experiencing. Again, thank you so much, our chair, for coming on the program today. Again, congratulations on being our chair. I'm going to always do this, so please be ready for
It's
me.
okay.
Thank
It's
you.
okay.
Thank you
Okay.
so much and enjoy the rest of your day. See you on the next edition of Radio Doctor.
All right. Thank you so much, and good morning, Nigerians. Bye.
All right. This is the Women at 1.7 Radio Doctor is broadcast Mondays through Fridays by 10 a.m. It's been a long, long, long morning for us all, but yeah, do stick around with us on Women Radio 1.7 FM. We have great music to keep you company. Do not go anywhere. My name is Fobi Bangbala, signing out this morning. Bye for now.